Well, hopefully you all can hear me okay and see the slides on the screen. Please do pop a message in the chat if there's anything going wrong for you. But welcome to our ECHILD Research Fellowship applicant webinar. Today we wanted to set aside some time to give you a bit of a briefing on the ECHILD research dataset and allow you plenty of time to ask your questions about that. There should be a lot of people signed up today, so if you see a question in the chat, rather than repost it yourself, please do like that and we'll try to get to those questions as well. So just a bit of housekeeping before we get going. Please keep yourself on mute, up to you as to whether you want to keep a camera on or off, but we do encourage you to use the chat function to post your questions in there, and please do like the questions if you'd like them to be answered, and we'll have lots of time set aside for Q&A in this one. The meeting's being recorded, so the recording will be made available, as well as the write-up of the Q&A as well. We'll attempt to get to any questions over email that we don't manage to get to in the meeting as well. So just to say a little bit about the objectives of this workshop. So this really is a focus on the ECHILD research dataset. So it really is an opportunity for you to learn more about the data linkage and the research questions that are of feasible and of interest and are priorities for us through this current fellowship call that we're promoting the dataset under. So we really encourage you to bring any questions that you have. This is your time to clarify anything that you want to about the dataset if you're unfamiliar with that. I'm just gonna move on to my next slides, just by way of some quick introduction. So my name's Greg Meredith. Some of you may have come across me on some of the webinars for the fellowship call, but I'm a senior research manager here at ADR UK, and I look after our research design and evaluation elements of that. And I'm going to pass across to Babusha.
I think I can see some familiar names coming up again. So I'm Babusha Wojciechowska. I'm part of the research commissioning team at ADR UK.
Great, and we're really lucky to have Professor Katie Harron with us today to kind of take us through the dataset. So Katie, do you want to introduce yourself?
Hi, I'm Katie Harron. I'm representing the ECHILD team here today, and we've been working on this linked dataset for some years, so I'm really excited to be able to talk to you about opportunities for accessing it today.
Great, and so before we get going any further, we do just have a very quick poll for some of you that may be familiar with this from other webinars, but we are really keen to understand a little bit about your experience with the data set and administrative data more generally. So you should see a little poll popping up now. We'll ask you 3 questions around your familiarity with the data set, administrative data generally, and your intentions in submitting to the fellowship call. It should be worth noticing that you can apply to use ECHILD outside of the fellowship call also, so we're just promoting that here. I'll give a few minutes for those questions to come in, and I'll leave the poll open for people. You can see the responses are starting to come in. That's really helpful, and this is just really helpful for us to understand who's intending to apply, to help us plan our assessment process and support the expression of interest stage as well. So just a quick overview of the talking points for today. As I say, the bulk of the meeting will really be given over to Katie to kind of run through the data sets and the research questions, space to take your questions, and then some recap and signposting to our fellowship scheme there. Very quickly from me before I hand over to Katie, just a quick signpost towards our fellowship opportunity at ADR UK. We are offering an 18-month research grant up to 175k with the deadline of the 10th of October to apply. ECHILD features as one of the priority data sets. Features as one of the priority data sets for that. So really going, I'll post the link to that opportunity in the chat function as well. But we did have a briefing on that funding opportunity this morning, and that recording will be made available and slides as well. So we'll share. please let us know if you did manage to make that webinar. I'm happy to share the links as well. So without taking any more time, I'll hand over Katie now to take you through the data set. Over to you, Katie.
Thanks, Greg. Yeah, if you want to click on to the next slide. So ECHILD brings together two main sources of data. Firstly, the National Pupil Database, which captures information on pupils attending state schools in England, and data from health, primarily from hospital episode statistics, which captures information on hospital admissions, A&E department attendances, outpatient attendances, and linked mortality data. And we've linked these data together for all children who were born since 1984. So this gives us a total now of around 20 million pupils, with longitudinal information all the way from birth up until the oldest in the cohort is around age 38. The data are de-identified, so NHS England conducts the linkage. The researchers and the ECHILD team don't ever see any of those identifiers, and then the de-identified data with all the identifiers stripped off are stored on the ONS Secure Research Service, which is how any of us access the data and how you would be accessing the data through the fellowship. If you want to click on one more, Greg, so the latest linkage that's been conducted by NHS England managed to link 99% of pupils to a health record. The linkage rate is very high for this kind of administrative data. What we will actually see in ECHILD is slightly lower than that, because the health data that we have access to is subject to the national data opt-out, which means that anyone who's opted out of their data being used for research purposes wouldn't be included in the linked data set. More recently, we've had approval to link in additional data sets from maternity services, birth notifications, mental health services, and community services data, which includes health visiting information. These are new data sets that are going to be available in ECHILD for the first time very soon. If you click forward once more, Greg, please. We've also implemented a mother baby link, which means that we can link mothers and babies within ECHILD, and that allows us to look at, for example, what sort of maternal characteristics and factors at birth, during pregnancy, or even pre-pregnancy might influence the child's outcome again at birth or later on in childhood. Okay, so we've got lots of information available on the data itself and what exactly is included in the data set in our ECHILD user guide, which you can see on the left there and you can access through our website. We've also published a couple of papers around, again, what's included in ECHILD and on the linkage process. The papers here were based on the original ECHILD dataset, which doesn't include the new additional health dataset, so maternity services, birth notifications, etc. But you can see lots of information on the ECHILD resources webpage there on all of the constituent elements of ECHILD. So there's data profiles for MPD, for the children looked after dataset, for hospital episode statistics, and lots of other things. So that's a good place to go to get more information too. Please. So this slide shows the different elements of how the health, education, and children's social care data fit together. So there are several different data sets within MPD and within the health data, and this can get quite complex. So hopefully this demonstrates how they all fit together. So on the top, on the left there, we have the education social care data, which comes from MPD, starting with school level characteristics. We also have pupil characteristics, so school census data, which is collected at different time points during the year. The early years census for preschool ages, pupil referral unit and alternative provision census, capturing those populations. Then in terms of educational outcomes, we've got the early years foundation stage profile, which is collected in reception year, and then key stage 1 all the way up to key stage 5 at age 16. information on absences and exclusions, and national client caseload information, which is post-16. We also will have data from the ILR, the individual learner record, and from HESA, and it will be part of ECHILD soon too. Within the social care data, we've got the children looked after return, capturing information on children who are in out-of-home care, and child in need census, which is based on any referrals to children's social care. These data are linked with the health data using a pseudonymized bridging file that will contain the MPD identifier, which is the anonymized pupil matching reference, or APMR, and the TPI, or token person ID, for the health data set. So in the health data, we've got mainly from HES, we've got information on attendance to outpatient emergency services, and then admissions to inpatient care, primarily, also some information from critical care. The mental health services data. These are more recent data starting in around 2015, and there's sort of overlap between these different data sets as they came in and were developed. Birth, information on birth, we've got the maternity services data set, birth notifications, and birth registrations data, and then we've also got mortality and the community services data set. So when you request the data, you'll be asking for the tables that you need access to for your particular research project. So you won't see the whole of ECHILD, but you'll select which of these tables for which years you want to access. So there's lots of caveats about the data, which can be found in more detail in the user guide. But for example, we have geographical information down to the MSOA level, the medium super output area, which is based on postcode of residence. And that geographical area covers around 7,000 individuals on average. It's also not possible to link data on children who only have contact with social care services prior to school age, as their record wouldn't have been assigned a pupil ID that just starts at school age. So this could cover, although we're not 100% sure about these children because we can't look at them within the data, but we think this covers around 25% of children who access or who are in care. And then, although inpatient data are well coded using ICD-10 codes in terms of diagnoses, and we can record up to 20 diagnoses for each admission, the A&E data, on the other hand, aren't coded as deeply as that. So lots of nuances to the data that's important to try and get your head around before you use it. Okay, next one, please. This diagram just tries to show how we can start to use these linked longitudinal data to build up a fuller picture of different people's pathways through health, education, social care, and their interactions with these services over time. So say we've got information about a child's birth, we have information on their early hospital admissions and whether or not they coincide with school entry. We might see admissions for injuries, we might see referrals to children's social care. We can follow this child up over time, even as they move into adolescence and young adulthood and potentially give birth themselves. If you could just click a couple of more times, Greg, please. So because we've got the mother baby link now, this means that we can link in the mother's record, which gives us information on the mother prior to giving birth, and also if this is a mother here who we're looking at and she gives birth, then we would have information about her subsequent children. Okay, next one, please. So here, apologies, it's just small. Again, you can access this in the user guide, but gives you an overview of the dates that each of the different data modules within the health and the education data are available. So you can see here, for example, the school level census starts in 2005. Children looked after data starts much earlier. And then the key stage data, attainment data starts in 95, and depending on which key stage you're looking at starts at different time periods. It's important to try and think, when you're thinking of your research question, about which data are available at which point and to try and understand the cohort that you will be able to capture and the population of children that will have data at which ages within each child. And then similarly, so the education data are collected in academic years. The health data here are collected in financial years. So similarly here, the outpatient data, sorry, the inpatient data, the admitted patient care on this list is one of the earliest data sets that starts in HES, that starts in 1997. You can see the mental health services data. We've got some data from 2006 and the most recent data set from 2016. So again, important to think about how these different data sets overlap with your cohort of interest and also with the education and social care data. So I'll try and give an example of this on the next slide, I think. Yeah, so here, if we are looking at someone who was born in 1998, next, if you just click through a few more, sorry, Greg, then we will be able to capture their school readiness data, the earliest foundation stage profile at age 5 in 2003. Then when they turn age 11 in 2009, we will be able to capture attainment by their Key Stage 2 record, and also provision of special educational needs, for example, that's captured in all of the school years. Then as they turn 15, perhaps we can capture a social care referral. And then if this individual gives birth at age 20, then we will be able to capture that birth and potentially link to their child, and then look at their child's school readiness data as the child turns 5 in the most recent year, which is now. So the data that we have in ECHILD will be refreshed on an annual basis. So hopefully that makes sense, and you can start to see how you can build up the longitudinal picture and fitting together all of these different data modules. So I want to give a couple of examples of the work that we've done using ECHILD to give you an idea of what sort of thing is possible. This plot comes from a study that we did quite early on, looking at the association between gestational age at birth and school attainment at key stages 1 and 2, or ages 7 and 11, for children who were born in the year 2004. So here you can see the pattern whereby the earlier a child is born, or the earlier gestation at which a child is born, the children who are born at earlier gestations are less likely to achieve the expected levels than those born at term, and that this effect persists all the way up until the end of primary school. But actually we see that babies who are born, if you click one more, sorry Greg, babies who are born even a few weeks too early, which wouldn't usually be classified as preterm, so 37, 38, 39 weeks, are still at a disadvantage compared to their term-born peers, and we're more likely to need special educational needs provision or have that recorded in the data. However, when we looked at special educational needs as a group, sorry, just go back one, Greg, we found that 2/3 of children with special educational needs were born actually at full term and didn't have chronic physical health conditions. So what we were able to do, because we've got such a large data set, we're covering almost all of the population in England, is look at not only at the preterm group as a heterogeneous group of babies born under 37 weeks, but look at each individual week of gestation, which is really important because it's the outcomes can be so varied. And we could also look at children with particular health conditions who were born at these different weeks of gestation. And this, I think, is really important, not only for giving us a better understanding of how to, or who to target prior to school start in order to give them the best possible start at school age. Also, what information that educational services need to know from health services, from parents, and also generating evidence that's meaningful for parents, not just saying this is what a preterm baby looks like, but this is what a baby born at 30 weeks with respiratory distress syndrome looks like, and that's what their outcomes look like. So that granularity of information can be really important. Okay, next one, please. So our original permissions for ECHILD were around understanding the effects of COVID and the lockdowns on different groups of vulnerable children. This plot shows the change in planned hospital care for children with recorded special educational needs provision or those in contact with children's social care services. And you can see that although hospital attendance has decreased for all children during COVID compared to the previous years, the children who were most affected were those with other support and particularly those with both types of additional support. So this had important implications for who should be targeted for catch-up care in the years post-pandemic. Next one, please. We also looked at how COVID affected specific subgroups who might be in need of timely intervention. So for this study, we took information on about 1,700 cleft lip and palate primary repair procedures and saw significant reductions in the number and also delays in the timing of these first primary CLP repair procedures during the first year of the pandemic. So compared with 2019-20, first primary lip repair procedures performed in 2021 were delayed by just over 1.5 months on average. And this will have, again, implications for long-term outcomes for these children. Next one, please. We're doing a lot of work looking at outcomes for children with special educational needs provision recorded as part of the HOPE study, which is looking at different health and education outcomes for different health phenotypes and also looking at the causal effect of SEND provision on outcomes. So one piece of work being done by Kate Lewis in our group is focusing on children with major congenital anomalies or MCA. This figure is very busy, but if you look at the left-hand side, you can see that 26% of children without a major congenital anomaly had SEN recorded by year 6, compared with 42% of children with any major congenital anomaly. And you can also see that in the different colours here that there's a greater proportion of children who have an education and healthcare plan, EHCP, which is a high level of support, or children in specialist schools, which is what you might expect for children with high levels of need. But what I really want to show here is again the power of having these population data, because even for these rare conditions, and major congenital anomalies only affect around 3.5% of children in this cohort, again we can look at more granular detail. So this plot actually shows 12 different system-specific subgroups, and these were based on having at least 200 children in each of these groups alive at the end of primary school. So we're looking at very rare conditions, but even so, we can still look at all of this detail. And importantly, look at the variation between groups, because where there's variation, there may be unmet needs where children aren't receiving the support that they might need, and where there might be opportunities to intervene. Next one, please. So Kate also used these data to look at the impact of policy changes, and in particular, looking at data before and after 2014, when there were major reforms of the SEN system in England. Click again, please, Greg. So this plot shows the absolute difference in prevalence of SEN for children with and without major congenital anomalies before and after 2014. So you can see that following the reform, the percent of children with special educational needs dropped by about 4% overall, again on the left-hand side of the plot there, but it dropped by 4.8% for children with major congenital anomalies. If you click one more time, please, Greg. And we also looked at whether this was driven by different levels of support. So if we go to the next slide, and just click through 2 more times, please. You can see that the major differences were driven mostly by that lower level of SEN support, not by the higher level of support provided under EHCPs. Okay, so I think that's it for examples of what we've done, and I'll talk through that quite quickly, but hopefully it will give you an overview of the types of analyses that are possible using ECHILD. Probably skips over some of the complexities of understanding the data to start with, and that data cleaning process, data management, creating the cohorts is definitely the most time-consuming element of working with these data. But now I'll talk about the different research priorities for ECHILD, and our permissions for sharing the data more widely fall under 5 main areas. So any research questions need to address one of these research priorities. The first is informing preventative strategies by healthcare, social care and education services. So I've just put a couple of example questions here. Some of these came from ideas that our network of people, researchers interested in ECHILD had given us to help support our applications to make the data more widely available. So for example, we could ask, do children with serious learning impairing conditions have lower rates of emergency hospital admissions according to whether or not they attend a specialist school or a mainstream school? We could look at the impact of policy changes to Healthy Start vouchers in terms of children's health and development outcomes. The second research priority is around informing children and their parents, and I think there's a lot of value in this and in how we demonstrate and advocate the use of administrative data in terms of the impact that it can have on the public. So for example, what are the long-term health outcomes for care leavers? What are the long-term health outcomes for children with special educational needs? The third priority is informing clinical and educational practice. The one thing we've been interested in our group is what might the optimal time be for liver transplantation based on what we know from the data of educational outcomes for children with liver disease. Or we could ask, does treatment for childhood cancer affect children's cognitive ability or mental health conditions in the longer term? So in these sort of range of questions, we're thinking about what do we need to know in order to generate the most effective procedures and guidelines for clinical and educational practice. The fourth one is on identifying groups who could benefit from intervention. So what are the trajectories of, for example, unaccompanied asylum seekers through the social care and health systems? What are the early health, education and social care patterns of children who develop mental health disorders later in childhood? So again, using the longitudinal nature of the data to understand patterns for different groups of people in terms of outcomes, and then to think about how we could better support those groups. And then the final research priority is around the data and methods for understanding the data, so understanding the most effective methods for working with these complex data sets. One thing that we've been thinking about in our group is what are the optimal ways of selecting control or comparison groups within population health research, particularly if we want to try to evaluate an intervention or policy change. How can we account for clustering of health conditions with families, within families, when we're looking at the association between these different exposures and outcomes? And this is something that we've not progressed too much, but will become more and more important as we use the mother-baby link and the fact that we can look at siblings within the data going forward. Okay, so all of the projects that I've mentioned today, as I've said, have taken a significant amount of time to set up. So understanding the data, creating the cohorts that are needed to answer research questions, including the phenotyping process, so how we group together different individuals based on the codes in the data, and validating those phenotyping procedures. It has been really important to involve all of the project partners so far in being able to establish ECHILD first of all, but being able to develop the research priorities and also to find the governance solution to be able to share these data more widely. But if you click one more time, Greg, please. It's definitely been a team science effort, and there's a lot of expertise now within the group that are or have been using ECHILD that we can draw on. We want to draw on this expertise so that we're not all accessing the data for the first time and feeling like it's an insurmountable task, but we can learn from each other, not reinvent the wheel, share codes that we use on GitHub, make things available to others, highlight areas where the data might have glitches or nuances that we need to understand before we all go through the same process of finding something strange and then not understanding why it's there. So we will share code on GitHub and constantly update our user guide and data catalogue with more information as we get it and as more and more people work through the data. And we're also hoping to develop an ECHILD training course for next year. So one more slide, please, Greg. So in terms of accessing the data, data are held only in the ONS Secure Research Service. So this means that all researchers who access the data need to be accredited researchers, and you can find out more information about that through the Research Accreditation Panel on the ONS website. At the moment, we're not considering applications to link in additional data to ECHILD. We want people to be able to access the data that's there already, but linking in additional data sets would require additional approvals from NHS England and from DFE, and is likely to be a longer process and not feasible within the 18 months of these fellowships. As well as being accredited researchers, individuals have to work within an organisation that has assured organisational connectivity. So it's worth finding out from your institution what this will involve. For example, in UCL, this means that we all access the data via UCL encrypted laptops and from specific locations, including, I should say, from home if approval has been granted for that. So the process will involve applying to UCL initially. So that's a conversation with the ECHILD team to understand whether your project is feasible and whether it fits within one of the purposes that I've outlined today. And then there will be a formal application to the Research Accreditation Panel. And there's a standard application form for that. We're also encouraging everyone to do an ethics self-assessment. And when all the approvals have been granted, then ONS will provide the data, again, minimised in the way that I described earlier by year and by specific data table. They'll provide a new share for each project that you will be able to access the data from. Okay, I think there's one more slide, that's our acknowledgement. Hopefully that covers most things. I'm sure there's lots of questions and I'm very happy to answer those.
Great, thanks for that, Katie. I think I promised that just a bit of a recap on the fellowship call, and we will send the slides around as well as a note of anything in the Q&A that we don't get to. There has been some questions that have come through, but just to recap on timelines, our fellowship call is currently open and closes the 10th of October. So as Katie mentioned, the team are really keen to talk to you about your project idea to establish feasibility and fit with those research themes. We're facilitating that through our expression of interest stage, but there will be contacts, email addresses and things shared as part of this as well on my next slide. So I think we're really keen to ensure that feasible applications are submitted as part of the fellowship call or any application to access the data. So please do go ahead and talk to the ECHILD team about your project. I think we're very happy to share the recording from the webinar this morning, which went into more detail about the fellowship call, which will unpack some of these. And just a flag to say that we're running a separate webinar on how to write a successful fellowship application. That's next week, drawing on experiences from our previous successful fellows that will share their approach to putting together their case for support, how they approached kind of their kind of methodology sections and writing their bid and submitting it to us. So an opportunity to come along and hear that next week. Just to share some contacts, and these will go out in the with the slides, and I think that's it now, and I'll just pause for questions and answers, and I'm just going to stop sharing now to kind of bring us back in the room, so I don't have to manage things across 3 screens. There has been some questions in the chat. There were a few questions, Katie, about onward linkage, and I know there was a note there, so hopefully I think that's clarified it. There's always a lot of interest in linking to ECHILD, and one of the more popular ones I guess we've seen is the linkage between the MOJ DFB and ECHILD that's come up a few times. But just to clarify that it is unfortunately at the minute a flat, no requests are being considered on onward linkage to ECHILD. Just to restate
yeah,
that.
I'd love to say yes, and some of these linkages are things that we're definitely considering implementing in the future, depending on working through the governance approvals. But at the moment, and specifically for these fellowships, it's a no. Although there was a later question I saw about linking in publicly available data, such as geographical data, and yes, that would be possible. Publicly available data could be ingested to the ONS without additional approval, so that should be fine. It's a good question.
Great, and I think the question about the geographical data, my assumption is that would be available through the NPD school census data, but is that a correct assumption?
We've got geographical data both from the health and the educational data. So we've got information on the area of the patient residence from the health, and also from the pupil residence, which hopefully would coincide, not always. Yeah.
Great. I think you had a really helpful slide on the cohorts and the different years moving through to understand the components of the data set. I hope that's answered the question around whether there are multiple birth cohorts in there. But if that person who posted the question wants to come back in and ask any follow-up, please do post a chat there. Is there anything else you want to share on the cohorts?
It's not that there are cohorts are already created in the data, but you can create those cohorts yourself based on year of birth and on the data availability. Yeah. So it's not just one birth cohort, but yeah, as you've described, you could create multiple birth cohorts from within the data, and that's what we often do.
Great. Thanks. Please do feel free to come off mic and raise your hand if you do want to speak as well. We won't bite if you do want to do that at this stage in the presentation. But please do just raise your hands if you have a question to ask live. I think you mentioned that you're updating GitHub. Is there links to GitHub and the code that you've developed? Is that available there for anyone that's interested?
Yeah, I can put a link to our wider GitHub page, which does have code that people have used on ECHILD. It's something that we're developing and we will add to going forward. But I'll put that link there. There will be eventually a separate ECHILD GitHub with a lot of more detailed information, including some like how-to articles, how to create a birth cohort, how to phenotype particular health conditions, etc.
Yeah. Brilliant. So I think there was a follow-up on the children living in care. The data is available, and I think you mentioned that you don't have data before the student would have a pupil reference number. Is that right?
That's right. So we can own, and we do have the children looked after data for all children, but we can only link it to the other modules of data if there is a pupil number assigned, and that only happens as the child enters school. That means that if a child has only been in contact with Children's Social Care Services before school age, we can't link them to any other data.
Just want to turn to data access, Katie. There's been a question around accessing this in the SafePod network. And you did mention that there are permissions to access it at home. Is that on request only on a case-by-case basis? And so SafePod network, yes or no, and then home access, yes or no?
That's right. So you would be able to access through the SafePod network, as I understand it, if there's access to the SRS. And if you want to access through the AOC, through your organisation, then it's an extra form that you have to submit requesting home access as well.
Great, thank you. I can see there's been some live answering of questions as we've been going. All social care data is linked via NPD. Does this mean that there is only social care data for adults if they were in school after 1991? I don't know if Nicola wants to come off and clarify.
Yes, that. I think that is you're correct. I think you're understanding rightly there, Nicola. Yeah. So they would have to have been young enough for their data to have been captured in the social care data after that was available in ECHILD, and after that could be linked to the MPD data.
Mm. Oh, we can't hear you, Nicola. Sorry. There may be a problem with the mic there. Not currently yet. No. You have permission to play around and try to come in, and we won't penalize you if you suddenly start making noise in the background. But please do. Yeah, we can't hear anything currently. We've had a question around the linking of fathers and whether that's possible in the birth registration data. Do you know if they were present at birth?
No, unfortunately not. The fathers identifiers aren't recorded anywhere that we can link to currently. We'd love to be able to change that, but it's not possible at the moment. In the future, we are planning to link to the UPRN, Unique Property Reference Number, which would allow us to look at people within the same household. So you could make inferences then about who potential fathers are. We don't have UPRN available at the moment. It's something we'd like to do.
Great, thanks. I can see Cheryl's raised a hand. Cheryl, do you want to come in?
Hi, thanks. Yeah, it was just around the availability of the most up-to-date data dictionaries, obviously in consideration that you've made all these new linkages, whether that's available yet?
Yes, it's to some extent a work in progress, but we do have a data catalogue available that we can send to you. So if you just email the ich.echild email address, then we can send you our current version, and it will very soon be uploaded to the website, so it will be available alongside the user guide.
Okay, thanks.
So yeah, so that will give you in all of the different tables the names of all of the variables and the relevant code lists, and for which years each of those variables are available.
Brilliant, thanks.
It's huge.
Yeah, thank you. Oh, and can I ask, sorry, just while I've got the mic, in terms of the process for discussing feasibility and project proposals with you, is the idea to clarify that happens at the EOI stage facilitated by ADR UK? Yeah, is it best to go through that route?
Yeah, we're facilitating that for this particular fellowship call, but obviously it's open to access outside of that as well, so we don't want to just make you use that if you just want to apply for the data without funding as well.
Okay, perfect,
just to
thanks.
flag that. Do you want to speak a little bit about working with the data in the SRS, Katie? I think we've had a question around use of Stata with the code and GitHub.
Emily, yes, Stata and R are both available in the SRS, so you can use either of those. And we, in our team, use both, so some code will be in R, some code will be in Stata. Some people do a bit of data management in one and then analysis in the other.
Perfect. I think one of the questions that often comes up as well is around discovering sort of current and planned research. And you mentioned throughout your presentation around areas you're planning to look into, I guess, using the data, but is there some way you would steer researchers to kind of discover previous research and how might they avoid duplicating any effort, I guess, with what's being planned in the team?
Yeah, good question. So we do have on our ECHILD website a list of ongoing studies and within the UCL team at the moment, and publications from those studies. And we will, going forward, make available on the website any projects that are happening. So once people apply to us and have been approved to access the data, then the summary of the project that they are working on will be available online for everybody to see. Yeah, so we'll have a sort of released register of everyone who's accessing the data and for which projects. So yeah, exactly that, so that people can know what's being worked on, whether there are opportunities for collaboration, the impact and the outputs, etc.
Yeah. Great. We've had a final question come in around the type of information related to COVID that's available in the education data. Do you know if any that is available?
No, there isn't really any information on COVID that we've got at the moment. We don't have any of the COVID testing data from the health side of things, and we don't. There's nothing really in there from the educational data side of things. There are some gaps in the data, if anything, where data weren't collected or where we're not allowed to use the data for certain purposes in those years. For example, we're not allowed to compare attainment across schools in particular years. So yeah, so not a lot of information on COVID there.
Yeah. Great. I'm going to keep moving to these. They're really helpful. I was wondering whether there are additional censoring that is required on top of the usual SIN or CLA to take outputs from the SRS using ECHILD.
Yeah, it can get a bit complex because DFE obviously have their own output control procedures. So for SIN, CLA, making sure that there aren't small file sizes, etc. And then SRS have their own version of those rules, and they're not always entirely compatible. But the SRS ones, if anything, are more strict than the health data, but not as strict as the DFE data, I think. But we can give clear information about the disclosure control measures that you need to adhere to for each of the different data sets. That's helpful suggestion. Thank you.
Great. I think there's a question coming back to the EOI, the expression of interest stage, and what you'll be looking for in that. Would you pick up on a piece of work that, if it was looking like it would duplicate something that's a report that's coming out soon, for instance, or would you flag that up to potential applicants and just to make them aware of anything ongoing?
Yeah, definitely. That's definitely something we can be on top of. Yeah.
Yeah, great. I think if you're pitching similar projects to other fellows, we probably wouldn't point that out, but I think that we'll try to make sure that we're avoiding duplication in the process there in terms of work that's already funded and ongoing and planned, as to the best of our knowledge, I guess. We don't see everything. There's a question on whether you can apply to analyze two separately. I guess that's a kind of more general fellowship question if you want to use ECHILD and another data set. I guess that's feasible. We're certainly open to that, I guess, and that would need to hang together in. And there's a question of, these are very, very large data sets that will be very demanding to kind of work with and take a lot of time. So
I would suggest in an 18-month fellowship, it's too much to try and do too.
So suggestion there that they are very, and I think we mentioned this morning in our workshop to really build in the beginning of your fellowship to familiarize yourself with the data and just give yourself time to do that. Are there any data on criminal justice involvement and or involvement with in delinquency in ECHILD?
No.
No, not yet. Not well. Yes, I think that we get that interest, and we had that from our Monday webinar on the MOJ DFE linked dataset question as well around linking to ECHILD, but not currently yet. I don't see any other questions coming in, and no raised hands. As I say, I think we've managed to answer everything live in the chat, and we will make the slides and the recording available to you. I think if there's nothing else that anyone jumps. Oh, Cheryl's raised hands.
Hi, sorry. It was just a follow up on the discussions around building in time for data management. Whether you had any ballparks, Katie, for the amount of work and time that we'd need to build in for, say, each data set that we're looking at?
It's hard to sort of pick a time frame out there without knowing how complex your research question is going to be, or which elements of the data set you want to bring together. But for any of these things, I think it can take a good 6 to 9, even 12 months maybe to properly understand the data and be able to set everything up that you need to develop your data analysis plan and see in the data and create the cohort and set it all up and then implement the full analysis. That's the easy bit, and in the process, I think.
Okay, no, that's helpful. Thank you.
It's really helpful insight there. Thanks, great question. Well, I really hope this has been useful to everyone. I think I think we've got another hand. I don't know if it's a legacy one. Ludovica?
Yeah, hi. Thank you so much. Just a quick question. If we're working with the NPD data already on the SRS, can we, for example, port code to this project that would allow us to take not 12 months to clean the data?
Yes, that's possible. Yeah, you'd have to export it and then re-ingest it. But yes, and there's a question there in the chat again about the data quality of the healthcare data. A bit of a hard question to give a sort of an answer to without going into lots of detail. But the outpatient data, there's lots of missingness in terms of the diagnoses or the reasons why people have particular outpatient admissions. We have the information on the specialty that the outpatient clinic falls under, and the events are there. We know when people had appointments and whether they attended them or not. But more detail than that is difficult to get from the outpatient data.
Do you think you'll be able to get a sense of sample sizes before applying?
Yeah, I think that's something that we can help with. So if you email us, we will have a look at being able to provide some sort of feasibility count.
Great. I think that's exactly what we're trying to pick up during advising on feasibility. If you're looking at some very, sort of specific conditions or something like that, to kind of give you a sense of the coverage of that. Okay. Getting some thanks. I think I'm going to wrap up and call it there. As I say, there's contact emails and slides and recordings that will be shared, so not the end of the conversation. And I think the invitation is come and talk to the ECHILD team about your project and explore that feasibility. Do that through the expression of interest phase if you're interested in the fellowships, but the door's not closed if you're interested in ECHILD outside of that process. And I just want to thank Katie for the time today, really. That was a really brilliant presentation, taking us through the data set and existing work there. So thanks so much, Katie, for that. I think
you're welcome. I'm excited to hear about the projects that everyone is planning, and I'm excited that more people will be able to use ECHILD after all this effort in creating it. So good.
Yeah, we're at the exciting stage. After years of putting it together, it's finally getting out there now. So really excited to see your ideas and the projects that you bring to using the data. So thank you all very much for attending today, and we look forward to receiving your applications. Thank you very much. Bye-bye.